It's been a while since I posted on this channel about POTS and dysautonomia, but I wanted to share some things I have learned. For others who have been dealing with this for a long time, you know that POTS is usually caused by an underlying condition. Not always, but usually it is. And unless you have some very obvious autoimmune disease or some red flag flashing on your blood work, your doctor is going to write it off as normal. I was so sick of being tossed around between doctors, between the GI doctor, the medical doctor, the cardiologist, the neurologist, you know, all the ologists there are out there. However, one of the best things I did was I went to my GI doctor about talking to a dietitian, and I found out a lot of issues I was having was actually considered to be mast cell activation syndrome. Mast cell activation syndrome is something that I brought up to my medical doctor a long time ago and was told, well, you don't really have hives or anything like that, so you might not have it. That's not true. We've learned that these conditions present themselves differently for everybody. He tried to send me back to the GI doctor, and that's when I realized none of these people are specialists in not only dysautonomia, but mast cell, anything like that. So I had to think outside the box and do something that I've been thinking about for a while and didn't want to go down that route, but I needed to see a functional doctor or someone who was not tied to insurance so that they can make their own rules, they could do their own tests, and they didn't have to follow their cookie cutter procedures. This doctor sat down and talked to me for an hour, whenever my history, whenever blood work, whenever issues that I had and things I brought with me. And just, I learned more from this lady in this short amount of time than I have in 25 years that I have been having heart issues and things I did not realize was POTS, and now I know was mast cell. That's when I learned about the great triangle of POTS, mast cell, and Ehlers-Danlos syndrome. Now, I could do a whole long video about EDS, but I have been trying unsuccessfully to be genetically tested for this for a very long time. It's stressful. I have every symptom of it. Insurance was always a problem in getting testing. I may not have it. You never know because everyone's different. But this lady is going to get me tested to see if I have it because these go together so often. And I encourage you, if you're out there and have all these questions, look into Ehlers, I call it Ehlers, it's not right, Ehlers-Danlos syndrome, EDS, just look up EDS, and mast cell activation syndrome with POTS. They are like this super triangle of horror. It all still boils down to your autonomic nervous system disorder. It's still dysautonomia. It just explains so much. And I may get into detail on another video. This is like way too long and no one's probably going to watch this much. But to try to explain a little bit more about what it is and what each individual thing is, because there's just not a lot of people that are getting answers. And they do have at-home tests you can do for testing like this. The testing that they do have for some genetic testing is outrageously expensive. And it should not be because, especially Ehlers-Danlos, I can't say that, man. Especially that it is genetic. So there is someone more than likely in my family that has it. I know that my sister probably has it, my grandmother, and my daughter, which is the reason that I really went on this quest, is because I want to know what it is. So because I'm seeing it in her, and she does have POTS as well now. Unfortunately, this last year she got diagnosed. And I don't want her to be 30 years down the road and not know the cause of this. I'm doing this for me and her to prevent this from getting worse, especially with this EDS. Like, you know, you have the muscle pain, joint pain, a lot of the eye issues I'm having, a lot of just weird or random things you wouldn't think would have anything to do and correlate with POTS or mast cell. I'm just learning so much. A lot of the foods that I was avoiding on a low FODMAP diet were causing issues still, and it's because mast cell has to do with histamine. So I probably should do a video on that too. But anyway, if you've made it this long in this long ass video, thank you. And I will try to get on here if anyone out there is watching, just to try to share what I have learned, because it's incredibly frustrating, and I want us all to know what is going on. I want everyone to find out, you know, the root cause of things, because we don't want to just slap a Band-Aid on it. We want to be better. We want to prevent further issues, and we want to treat and maintain our symptoms. They may never go away, but we don't have to live like not knowing and, you know, triggering things that we don't even know about to make it worse day to day. That's not fair. These issues suck already to live with. So it's time that we learn more and did something about it. So I'm going to try to do my part and share what I learn, and let me know in the comments, I guess. That sounds weird. I never say that because I don't have many followers, but just let me know if there's anything you want to know about or anything you would be interested in me sharing that I've learned about this, and I'll try to add more. So thanks for watching this little rant here, and good luck with your research and issues that you're having.